Welcome back to RohrichKnosePodcast. I am honored today to have one of my dear friends from New York who's a world-renowned plastic surgeon and a phenomenal, an outstanding, not only a talented surgeon, but he's a talented artist, David Hidalgo. He's a clinical professor of surgery at Cornell, and he trained at NYU, and he's a true artist and a surgeon. You know, people talk a lot about artists and surgeons. Well, here's one. Just if you follow him on Instagram or look at his YouTube channel, you'll see he's truly an artist and a surgeon, and there's very few of them. So David, welcome. How are you?
Thanks, Rod. Great to see you.
Good.
What are we talking about today?
Well, we're going to talk about facelifts. I mean, you know, you're in the heart of one of the world's most amazing cities, and obviously facelifts are a hot topic. And, you know, there's a lot of confusion out there about facelifts. And, you know, in social media, we talk a lot about, you know, what's the best facelift. And I want to talk about the truth about facelift surgery, because you're a very honest plastic surgeon and you've got incredible experience and expertise in facelift surgery. So I want to talk to you about some of the things that we talk about, not only at meetings, but also to the consumer about what is the truth about facelifts. I mean, are all facelifts the same?
Well, Rod, you know, the biggest questions I get from prospective patients is the deep plane versus the SMAS lift.
Right.
And as you know, there's a lot of hype about it. It's two fundamentally different ways of doing something. So I think a lot of people who listen to this would like to know about what is the difference and what is that all about.
Yeah, let's do that. Tell me about it.
Okay. So the deep plane facelift, which is popularized by facial plastic surgeons, we're talking about the deeper layer under the skin that does most of the brute force lifting and reshapes the face without having to pull hard on the skin. So everyone's into doing something with that deeper layer. The deep plane facelift means that separate deeper layer is still attached to the overlying skin that we lift first, so that when you move that, you're moving them together. And I don't favor that, because when you separate them, which is what a SMAS facelift does, you have the two layers, you can move them independently.
Right.
You can move them, as we say, in different vectors or different directions. And facial shaping, to me, is best when you're pulling that deeper layer more vertically upward to get rid of the jowl here. And when you do a deep plane and the two layers are stuck together, you can only move them together.
Right.
So that's one of the things I don't like about it.
Let me just stop you there, because I think people really need to hear that, because I think that's the big difference. The biplanar facelift, and of course, I agree with you on that the biplanar SMAS facelift, I think, to me, it parallels aging, because aging doesn't age the same in all facial layers and in all layers of the face. So why would you pull one way and try and correct everything? And I think you can't do that. And I think that's what Dr. Hidalgo is saying. And I agree with that. And I know you do a SMAS facelift. I do a different variation of a SMAS. But so what type of facelift do you do?
Well, you know, this leads into the other benefits of the SMAS facelift, and it gives you the option of doing a different technique depending on the patient's individual anatomy.
Right.
For example, patients who have, they have a really strong, broad jaw contour, they need mainly something lower down, and where you just tighten the SMAS with a SMASectomy or a SMAS plication is very effective for that. In patients who have more of that narrow face and the fat on their cheeks is coming down, you need to move the whole SMAS. And I do what you know as the extended SMAS, because you get more correction in the midface. I think that's really important, to have different techniques to fit a patient's anatomy. Another thing which I don't like about the deep plane, because you're sort of limited in terms of what you can do. You're doing pretty much the same thing in terms of that movement on that second layer.
Yeah. No, I think that's a great explanation. I agree with you, and I vary the facelift based upon the facial analysis. I mean, just like you described, if they're a big round face, I'll do a mastectomy is very powerful. And, we've seen that from multiple studies done. And then the extended SMAS, which was popularized by Dr. Stuzen and Baker, is a phenomenal lift for that more oblique lift. And I think the other thing that I really like, and talk about fat. I mean, I think fat has been the missing link in facial surgery in the last decade. So do you use fat with your facelifts?
Well, fat is okay. My problem, Rod, is that I don't see consistency in terms of fat survival. So, and we can also talk about, these facial procedures have many different components beyond just the face that we're doing other things.
Right.
And you have to think about time management for the whole procedure. So you want to put your time into things that you think are really going to make a difference. And while fat grafting is extremely popular in our specialty now, I'm not totally sold on it because I've done long-term follow-ups in my own patients, and what looks great at 6 months is gone at 12, or 6 weeks is certainly gone by 6 months. So not a huge fan. I know I'm probably the minority in our specialty in that respect. But again, I look at the whole picture and all the things we want to do during facial rejuvenation. And
right.
You don't want to be in the operating room for longer than you need to be. But all these things are additive, and it depends on where you want to place your emphasis.
Yeah, no, I agree. Of course, as you know, I'm a big fan, and have used facial fat with facelifts for well over 15 years. And I think you're right. I mean, nothing lasts forever. An average facelift lasts 8 to 10 years, maybe a little longer. Depends how you do it, but also who the patient is. But I think facial fat augmentation in the central face is very important. And of course I like to place it deep. And I think it lasts longer in those planes. And especially in the patient that's got that vertical face and it's got a lot of facial wasting. I mean, don't you think that's where facial fat augmentation works well? And yes, sometimes you repeat it. Our good friend, Dr. Stuzen, at least in the past, he used to bring him back at 6 months and fat graft him again. I mean, I sometimes do that, but most of the time if they have lost it, I'll put some facial filler in deep, and that lasts a little longer. But nothing is forever.
Yeah, no, it's a great concept. I'm still just trying to sort it out in my mind.
Okay,
how much emphasis to put on it.
Okay, so what about the adjuncts? I mean, I rarely just do a facelift. I mean, I do face and eyes and perioral laser and fat augmentation, and in so many patients. And of course, I do a lot of rhinoplasties too. So what is your, obviously based upon the facial analysis. So what are the adjuncts that you find to be most useful and most powerful in your practice?
I think there are several ones that are really critical. And if we're talking about facelifts, we're talking about mid and lower face. The eyes are a separate thing. And yes, we do eyes a lot, but we're not talking about that. In terms of specific adjuncts, I think there are several that are easy, very powerful, and make a big difference. Number one, chin implants.
Yep.
If you have someone with microgenia, you improve their face you improve their neckline from the lateral view. And it's such a simple thing to do. It's not like breast implants. It's one and done. Rarely any problems with them.
Right.
So that's number one. Number two, as lip lifts are very popular now, and I think overutilized, particularly in younger patients.
I agree.
But in the older patients that we see for facial rejuvenation, where that upper lip is long, it really has significant impact because, as we're also rolling out the upper lip. We're adding lip volume. We're decreasing the length between the lip and the bottom of the nose. I mean, that's a home run in the right patient. And then moving up, as you know, nasal tip plasties are simple to do, and they make a big difference because as we continue to age, our tip cartilages grow, the tip comes down, and it adds an element of youth to just pick the tip up. And those are three easy adjuncts, in addition to regional resurfacing, like upper lip rittids with dermabrasion or laser, whatever tool you like to use. I mean, these are very important. It sort of finishes the picture. Yep. And I do one of those things in most patients, if not more.
No, I agree. And I think the lip lift in the true aging patient is an incredible adjunct. But you got to choose your patient well. I mean, when they smile and you can't see their lips, especially at the down corner of the mouth, I don't care what kind of facelift you do. If you don't, you can add the power of that lip lift is amazing. And I think that's very powerful. And then regional resurfacing, especially in the lighter skin patients, work incredible. I like lasers and chemical peels, dermabrasions as well. But I think it's powerful. I do a lot of rhinoplasties with them, and I think that is a great adjunct, because if you have a beautiful new face and the nose is still aging, it doesn't look good. So you want to make the eyes and the face and the nose match. So I think that's great. And I think that the chin implant is probably the best implant that's placed in the human body, don't you think? And it lasts the longest, because people always ask me, how long is a chin implant? And I say, gee, I've put in thousands, and I don't know if I've probably taken out one or two in 30 years. What about you, David? It just, if you place them precisely and correctly, it lasts a long time.
It's one of the biggest home runs of all the procedures that we do. And as you know, in the young rhinoplasty patient, it makes such a huge difference too. But yes, I agree 100%. They're simple to do, rarely, if ever, have any problems, and they don't need to be replaced. So, it's probably underutilized. You got to have an eye when you look at your patient beforehand, and because sometimes you can miss that. It's such an easy thing to do.
Yeah, no, I agree. And I think, the whole thing today is people don't want to look operated on. They don't want to look like they've been done. So, and I don't know how it is in New York, I'm sure, but in Dallas, I mean, so many of my patients come to see me, they said, I'm scared because I saw, my neighbor, and, she came out of hiding after 3 weeks or 3 months. And so tell me the things that you feel are important to prevent that done look, because honestly, I can't stand it. I see so many patients, that Hollywood windswept look, and, that's hard to fix. It's kind of like a bad rhinoplasty. Everybody knows it, but nobody wants to say anything about it. So tell me what are the gold standard things to prevent having that done look in facial rejuvenation? And I'm sure you see them in New York as well.
Well, we do, Rod. And I think those things are really, surgeon driven.
I agree.
I think, surgeons we're busy people. We put a high emphasis on efficiency. And some of our colleagues, they just want to, sad to say, they just want to bang these procedures out. And so I think probably the biggest thing is not taking enough time to the way you move the skin, the way you do your incisions when you close them. It's less related to what you're doing underneath. And I just think it's in also having the eye to plan your incisions so that they're very inconspicuous,
right,
and not pull on the skin so much so you have distortion. There are certain patients who keep having facelifts when they should stop, and they'll always find someone to do it. And those patients are going to look overdone because there's nothing else you can do, and you shouldn't do them, and they shouldn't have surgery. But for the first time patients, I find distortion is unusual unless the surgeon is not moving the skin correctly and is not taking the time on the scars.
Yep. No, I agree. And that overdone windswept look is just, it's almost like a rhinoplasty. It's so hard to fix, and it's such a stigmata. No, I agree. And I think, like you said, David, take your time, analyze the patient, and, do the right thing. Don't make them, we're in the face protection, not witness protection program. So we want to keep them, looking like Homo sapiens. And I think sometimes, people, the crazy thing, like now you see, they want that fox eye look, that's horrific. I mean, it's one thing to paint it on with makeup, but it's quite another when people are doing those procedures. It's terrible. I mean, I don't know. And unfortunately, sometimes they are some of our colleagues in plastic surgery. So it's a real It's a real challenge. So I would say, choose your surgeon wisely. Don't you agree? I mean, I think it's experience, it's expertise, it's their sense of artistry. I mean, look at their website, look at their Instagram, look at David Hidalgo's. I mean, it's just a class act. Everything he does is a class act. That's the kind of plastic surgeon you want to go see, not the guy that's whipping out, 20 facelifts a week. You want to have somebody that really designs and is an artist with your face, because you only have one face. You can't bring that back. So David, in wrapping up on this, so what about your recovery? I always hear that, I see patients, from around the country, and the recovery varies. The recovery is a little different in New York, certainly a lot different in LA, in Miami. In Dallas, usually a facelift's about a 2-week recovery. I get them in makeup and that's fine. But 4 weeks before they're, obviously back doing everything. And then if there's somebody else, they may take a little longer. How about you? What?
Well, I agree, Rod. I tell my patients by 2 weeks, they're going to look decent. They're not going to be ready for a black tie event if people still do those things. But, 2 weeks, 2 weeks, they're pretty good. I think the big dividing line is when you do simultaneous resurfacing, because that's going to extend them by a week for sure.
I agree.
So, you have to really spend some time and explain that to them. But for the vast majority of patients, you're not going to see the incisions unless the patient has really short hair. But, we do this in men too, and it's never a problem.
Right.
By 2 weeks, things look really good. So I would say, but between 2 and 3 weeks, definitely turn the corner and starting to look good.
Yep. No, I agree. And I think that's a cardinal rule, because there have been facelift procedures done in the past that are no longer done that people would take months to come back. If you can't get a person back kind of in the public eye in 2-3 weeks, that's probably not a procedure you want to have done. We want to make sure that we're bringing people back and having them looking refreshed. And, I always tell my patients, they have my cell number. So, you can call me if somebody says, "Oh my God, you had a facelift." That's terrible. It's like saying, "Oh my God, you had a rhinoplasty." So in wrapping up, David, I think you've given us some incredible caveats. Choose a board certified plastic surgeon that has expertise in facial aesthetic surgery. That's an artist that will analyze your face, that will take his or her time, but also really give you an idea of the type of results you're going to have, and do things that are done safely and that will be impactful and positive for you. So closing thoughts, David?
I think, facelifts are more and more popular. Patients are very fearful of them. But to your point, I think if you find the right surgeon for you, they can get you through this process with far less hubbub than you expect. It's most patients, when they come through the other side, say, "Wow, that wasn't so bad," and they have so much apprehension. So we can go a long way to relieving that.
Yep. No, I agree. Well, and this is an incredible segment, David, because really this empowers you to be a better you. So, join me in thanking Dr. Hidalgo, and we're going to share with you his Instagram and his website, and what a phenomenal plastic surgeon from New York City. Thank you, David, for taking the time and joining me.
Great, Rod. Thanks.
Bye-bye.
Great seeing you.
Yep.